The meniscus is a C-shaped piece of tough, rubbery cartilage that cushions and stabilizes the knee. Each knee has two. The lateral meniscus is more circular, and the medial meniscus is a C shape. Both are attached at the front and back of the knee, allowing for mobility, but also making it a structure at risk of injury. The meniscus can tear in many ways and locations, and recommended treatment will depend on size, depth, and location. Longitudinal tears run parallel to the fibers of the meniscus and typically occur in younger and more physically active individuals from repeated motions. Complete longitudinal tears can result in a bucket handle tear, which can flip or fold into the joint, causing locking of the knee. Radial tears originate from the center of the meniscus and extend outwards, affecting shock absorption. As these occur in the area with poor blood supply, they have little chance of healing on their own. Peripheral tears are located on the outside of the meniscus. These tears often respond better to treatment and repair due to better blood flow or vascularization. Degenerative tears occur with age and wear. They usually consist of fraying and small accumulated tears. Most people develop degeneration at some level, but it isn't always symptomatic. A root tear occurs at the meniscal root, where the meniscus attaches to the tibia. This type can significantly affect the stability of the knee joint. Because treatment can vary greatly depending on the type and location of the tear, obtaining an accurate diagnosis is essential. An MRI can provide detailed images of the meniscus and confirm the tear. An important distinction for diagnosis will be whether the tear occurs in the more vascularized red zone with better blood supply, allowing for self-healing or repair. The middle body, with fewer blood vessels, but still some blood flow available. Or the white zone, containing no blood vessels and receiving very little to no blood flow. Surgery is not required in all patients with a meniscus tear. Non-operative treatment often includes a period of rest followed by a course of physical therapy. For some cases, an injection may be recommended to reduce pain and swelling. Icing and taking NSAIDs can help relieve pain and inflammation, while taking appropriate supplements for joint health may help the healing process. If the conditions are favorable for a meniscus repair, the surgeon will sew the torn pieces of cartilage back together so they can heal on their own. In some situations, the torn meniscus cannot be repaired, and a meniscectomy will be performed. The surgeon will trim away the torn meniscus tissue, then the edge of the remaining meniscus is shaved smooth. This helps relieve pain and restore joint function. Meniscectomies are typically performed using arthroscopy, a minimally invasive surgical technique. Surgeons make small incisions and use an arthroscope to visualize and access the knee joint, reducing recovery time and scarring compared to open surgery. The procedure can reduce pain, improve mobility and stability, and help patients return to activities. But it can also increase the risk of arthritis long-term. Because the roots of the meniscus are responsible for transmitting weight evenly across the surface of the tibia, a root tear requires a more extensive repair. To ensure the root is reattached properly, the surgeon will drill a small hole from the outside of the tibia into the knee joint, next to the natural attachment of the meniscus root. Next, sutures are placed and threaded through the hole in the tibia. The sutures are anchored to the tibia in order to stabilize the root attachment and restore function to the structure. Recovery time after a meniscus injury or surgery can vary widely. Not 3 to 6 months or more to achieve non-operative healing typically takes around 6 to 8 weeks. But if the injury persists after 3 months, surgery may be recommended. After a meniscectomy, most patients can expect to resume light activities within a few weeks after surgery. Full recovery, including a return to sports and strenuous activities, typically takes approximately 4 to 6 weeks. Recovery from a meniscal repair is longer compared to meniscectomies. It can take full recovery. Extensive rehabilitation is required, often involving a combination of protective weight-bearing, strength training, and a gradual return to normal activities. If the tear is complex, like a root tear, or if multiple tears are repaired, recovery can be more prolonged. It may take 6 months or longer to achieve full recovery, and some individuals may experience continued improvement for up to a year. Recovery for all injuries and surgeries should always be supported with proper nutrition to ensure your body has what it needs to heal.